and I was I was down in Marin running Health and Human Services in Marin, and so we both had fairly high level jobs, and 10 years of each of that, and we made enough to just say it's over. We're not doing this anymore.
I hear you. It's a lot of work, and people that don't understand sometimes how much working for the government can be a all-consuming profession.
Yep. Exciting at times and boring and drudgery at other times, but
it's true. You get all of the above, right? Yeah. So hi, Orlando.
Hi there.
Orlando, thank you for fixing your name. When I put the like apostrophe, does that happen to you? Like in a panelist link for some
That's
reason?
What I was doing when, yeah.
I'm like, well, he'll fix it.
Yeah.
Okay, cool. Thank you.
There's Ben. Aha,
Ben.
there he is. You're muted.
Hi there.
There you go. Yeah.
Good afternoon, y'all. We're gonna wait, obviously, for a couple more minutes, but I'm very happy to see you all and here on time. Thank you very much.
There's Kevin.
Would you prefer us muted or not muted when we're not speaking?
Well, thank you for the question. If you have background noise, please mute. If not, you don't need to.
Okay.
I have a little dog. She's very loud. I'll mute if I start hearing her.
Thank you.
I just got my shipment of Girl Scout cookies, so I may mute when I eat one.
Oh, I just saw those came in. I got to order a bunch. I love Girl Scout cookies. There's Ernesto.
Okay. 5 of you. Is this a good time for you all? 4:30? If we were to do this again at 4, yes, 4:30? Okay, good to know. Okay, we are waiting for Betsy. Susan. All right, well, I don't have Betsy yet, but we are going to get started. Good afternoon, everyone. Thank you for attending the very first Measure O Citizens Oversight Committee. I appreciate you hanging in with the very long process of getting you even on this committee. So thank you, it took a while. We will elect a chair and vice chair who will call these meetings to order in the future, but for now it's me. We were going to have Kelly Ritter from our fiscal department come to just share the fiscal piece, and she had a family emergency, so Susan Kelleher is here in her place. Thank you, Susan, for joining. And then I thought, since this is our first meeting, let's just go around and introduce ourselves and say whatever you'd like. If you'd like to say why you were interested in serving on the committee, or a little bit about where you work or what you do, or whatever you feel comfortable saying. I am Leah Benz. I work at the health department. I did a lot of project management for Measure O up until it being on the ballot, and then served on the campaign committee with Shirley Zane and lots of others, and very, very happy to see it pass. And now we're here in implementation, and it's really exciting. I just really appreciate you all being willing to do this work. And I'll just call on someone, and then that person can call on someone else. So Ben, why don't you introduce yourself?
Hi, everyone. I'm Ben Ford. I'm appointed to the Measure O committee by the City Selection Committee. So I'm one of two representatives of the cities in the county, along with Kevin. And I'm excited about Measure O, a big supporter of the goals of the measure. So I'm excited to be a small part of seeing it happen. Oh, and I'm a member of the Cotati City Council. Should have said that.
Thank you. Gregory, would you like to go next? You're on mute, though.
Thanks for reminding me. I'm appointed by the Board of Supervisors and a longtime nonprofit executive director, fiscal director, treasurer, president. I've been in nonprofits most of my life. And when I wasn't in nonprofits, I worked for Marin County in the Health and Human Services Department. I, at one point, was the executive director and the fiscal director of Community Support Network, a provider here in the county that's provided for a long time homeless mentally ill services. So that's where I first got involved with the mental health department, was responding to that time when Ronald Reagan dumped people out of the system. And we, Community Support Network, were the first one in the state to sort of come from the community and try to respond. And so I had the pleasure of working with a whole lot of people who cared a lot about mentally ill individuals. So that's how I first got into it. That's where my passion for this topic came from. And other than being a fiscal guru for everybody, I gravitate toward trying to find out how money is spent. So those two things kind of collided, and it made a lot of sense for me to volunteer.
Well, thank you. Thank you for your expertise as well. Betsy, welcome. We're just introducing ourselves. I will ask Ernesto to go next.
Thank you. My name is Ernesto Oliveras. I've been in Sonoma County since 1979. And since then, I've been working on addressing many of the issues that are covered under Measure O in various capacities. Currently, I represent Providence as the Northern California Regional Government Affairs Director. And I've been involved in a number of mental health, homelessness, and so many other efforts in our county for many, many, many years.
Thank you. Thank you for being here. And Shirley.
Yeah, thank you. You know, this particular tax is very personal to me. I worked extensively to get it passed, and probably most of you know we passed by less than 1%. And I really think making that it personal in terms about the suicide survivors, of which I am one, during office too, when I was in office for 12 years. But prior to that, Greg and I have a lot similar backgrounds. I ran 2 different nonprofits, including the Council on Aging and Hospital Chaplain Services, and started Mental Health Services Act programs, including the mobile support team and programs for seniors and depression and early intervention, both at the county and at the Council on Aging. So as a former therapist also, and as a survivor, I think that there's nothing more important that we can do politically right now is to find more additional resources for mental health and then to leverage them, and to remind everybody that, you know, without those mental health services, people do die. I wanted to just add a personal note too, that since leaving office, I get to be a full-time artist, which is what I love, but I've combined it with being a CASA too, court-appointed special advocates for traumatized foster kids. And so I've come full circle because I used to work with traumatized kids as a clinician. And then I'm working as a CASA and in our foster care system. And I just love it, working back with kids again after working with seniors and veterans too, still working with veterans in terms of veterans housing for homeless. So anyway, it's great to be here. It's great to see such a wonderful panel too. You know, you guys are fabulous. And I was also appointed by the Board of Supervisors.
Thank you. Thank you so much for that. Orlando, would you like to introduce yourself?
Sure, thank you. I'm Orlando O'Shea, and you know what, my main, kind of my heartfelt reason for saying yes to this is that I have a son. I have two children on the autism spectrum. I have a daughter who is 19, and I have a son who is 22, and he's dual diagnosis, so he also has bipolar disorder. And we've really had to access, since his adolescence, especially the mental health system in various capacities. And so I've really gotten to see when that works and when that doesn't work, the consequences for when it doesn't work. I also, I'm personally a returning student. I'm just finishing up my BA in psychology, applying to graduate schools, but I worked for the last 5 years. I identify as transgender. I worked on Trans Lifeline, volunteering as a supervisor and a crisis counselor for the trans community. So I really have a heartfelt understanding of issues of crisis and suicidality too. So I'm glad to be here. I'm looking forward to working with everyone. Thanks.
Thank you. Kevin.
Thank
Hello.
you. I too am an appointment from the mayor's and council's side, and I'm a city council currently in Petaluma. And for the last couple of years, I've been on the Continuum of Care Board, and really worried about homelessness in the county. That's been a bit of my focus, and we all have to recognize that a large part of that comes from mental health issues. We absolutely need the resources, and so with great push so hard to get this measure over the line.
Thank you. And Susan, would you like to introduce yourself? Susan.
Yes, hi, Susan Kelleher, the supervising accountant for behavioral health. I am here to represent the fiscal staff that couldn't be here, and I'm really glad that we have this Measure O funding to continue a lot of the good work that the department does.
Thank you. And Betsy. Hi.
Hi, sorry all for being late. My name is Betsy Chavez. I think I was appointed by Supervisor Gorin's office, and I would say I do various things. So I'm part of the mental health board. I'm also part of the Community Development Committee. I myself have a brother who has schizophrenia, and a lot of my family members do suffer from mental health themselves. There's a lot of stigma with mental health. I've also worked with within my own family. To say I've also worked with various nonprofits that deal a lot with mental health services and meeting the needs of the community. And so hearing a lot of the needs directly from community members, from my own family members, I often advocate on behalf of our Latinx community and to help understand just the discrepancies, and as well as the stigmas that we're all faced with. And knowing that I feel myself well resourced, I have a master's in counseling, was a counselor back in high school for 4 years, and have teenagers myself. I have actually they're almost adults. I have an almost 20-year-old daughter and 18-year-old twins, as well as a little 2.5-year-old. And in having a family with mental health issues, being a mental health professional myself has been really difficult. So I can only imagine and always advocate on behalf of other families who don't have the support and don't have the knowledge base, and is very empathetic and sensible to those needs. And so I'm happy to be part of this group here. I'm happy to meet new faces, and I'm happy to see familiar faces. So thank you so much for having me here.
Thank you. Thank you all for being here. We won't then meet that often because we are an oversight committee. So I don't know that we're going to get to know each other super well over the next 3 years, but it is a 3-year term that you're all serving. So make friends. Today is really our initial meeting. We aren't going to dive too deep into a fiscal report. We just really need to establish ourselves, get a chair and vice chair, review the bylaws, approve them, answer any Brown Act questions. I think you're all probably familiar, but just in case you're not, we'll talk about it. Go over the calendar for the next meeting, make sure this meeting time works for everyone, and that'll be it. So it might not even take the full time. Does anyone have any questions about any of that?
I don't have any questions, but I just want to acknowledge what Betsy said. You know, the personal stories I think are important. I think some of those personal stories draw us here as well. And you raise a couple of very important issues like the stigma that is placed on mental health, especially with our Latinx community. That has gone on in my family. You know, we don't talk about stuff historically. I lost my father to suicide back in 1988, and I've had other family members that have dealt with mental health issues as well. So it's something that we don't see in people when we see them, but until we get to know each other and start sharing, we realize how prevalent an issue this is, especially when it relates to mental health issues. So so thank you for speaking up, Betsy, because I think it's important that we are here, not just because we're interested in the topic, but we're all touched by this every single day. And it's important for us to come together to be a part of this effort. So thank you.
Thank you for saying that. Thank you. So I'm going to dive in into just the, hold on 1 second. This. So what you're looking at, and you've seen it, this is basically the Bible of the ballot. The ballot language, this is what we refer to. This is the measure language, the expenditure plan, the order of the oversight committee, your role, the board's role is all in here, and we refer to it a lot just to make sure we are doing what we said the voters voted and agreed on. So if you ever, this is a document I can send you anytime, but as a member of this committee, this is really where the meat of what we're doing is. So I'm just going to read the ballot language just to remind us all what it is we're here to do. The ballot language said to provide local mental health and addiction services and facilities for children, adults, veterans, and seniors, and those experiencing homelessness, including permanent and supportive housing, crisis assessment, emergency psychiatric care, early detection and intervention, suicide prevention, and opioid and substance use prevention, treatment and recovery. Shall the County of Sonoma establish a countywide quarter-cent sales tax for 10 years, providing approximately $25 million annually, with annual audits and a Citizens Oversight Committee to ensure funds are properly spent. Didn't say committee, but that's what you are. So that is what we're doing here today. We are that committee, and we've definitely started receiving some of that $25 million. And we will go over the first year of expenditures today, but we will go over the first real year past that first few months in the first fiscal year at our next meeting. But I wanted to just, you don't need to read all of this unless you want to, but the part that's really important is this part, the expenditure plan itself. So all the funds for that $25 million come in and are immediately put into these 5 buckets of funding, 5 categories based on these percentages. So that is already set within this expenditure plan language. That can get changed by a 4/5 vote by the board, but they haven't done that at all yet. So this is all still happening this way. And 98% of the funds go to the Department of Health Services, and 2% of the funds go directly to the CDC, the Community Development Commission, which is roughly $500,000. And the categories are behavioral health facilities at 22%, emergency psychiatric crisis services at 44%, mental health and substance use disorder outpatient services at 18%, behavioral health homeless care coordination at 14%, and the transitional and permanent supportive housing at 2%. So we will, throughout our time on this committee, we will do program spotlights and talk about specific programs we're really excited about. We are in the process right now of transitioning. We don't have a behavioral health director at this time, and we are in the middle of hiring one. So the behavioral health director will always attend these meetings, and a fiscal director as well. So you have me for today, so I can't probably answer all the questions you may have, but eventually we'll have some more leadership at these meetings. But this meeting, it's fine because today we're really just getting ourselves set up. But I wanted to just remind you that the board does direct the spending with input from staff at the CDC and the Department of Health Services. This committee does not direct spending. This committee looks back at spending that's already occurred and makes sure it aligns with what the voters agreed to. So,
Leah, could I
but
get you to clarify something? Because I think it's kind of important for everybody listening. You mentioned that 98% goes to county health services. That doesn't mean that it doesn't go to nonprofits, because we have tons, county has tons of nonprofit partners in terms of contracts, correct?
Absolutely. Sorry, you're correct. So that's just where it starts. And then it gets contracted out to lots and lots of partners for whatever the program that we're doing. If the county does not do probably half of these services, we are partners with many, many groups in the community. And some of you might actually represent or be on boards of some of those groups yourselves. And should we ever come to be looking at something that, say, the city of Petaluma received funding from Measure O, which has already occurred, Kevin may want to recuse himself from conversations around funds that went towards the city of Petaluma. So I appreciate you bringing that up, Shirley, because that does come in. One of the things that goes along with being on an oversight committee is that you technically are not conflicted at all, because you are not directing funds, you're just looking back and making sure funds were spent appropriately. But so anybody could have served on this committee, even if unless they worked for the health department or the CDC. That's where we put the conflicts at. But we ask you to recuse for conversations where you would be technically, theoretically conflicted or have a perception of conflict in the community, so that we are not, just to be above board and make sure no one feels uncomfortable with the role you play in your day life as you make decisions and approve expenditures here. Shouldn't come up today at all, but in the future we'll talk about that. So this is the information about the Oversight Committee. I won't read it all, but you do all represent either as a community member, or you represent a specific person that was required to be on here, like a hospital representative or representative of lived experience, etc. You are serving 3-year terms, and you will be approving and contributing to an annual report that will go before the board as part of their budget process every year. Anyone have questions about anything within the ballot language and expenditure plan right now? Okay. All right, next on our list of things to do is to elect a chair and vice chair. There's 7 of you, and it can just be a volunteer. It won't be a hard job, but it is something we are required to have. The chair, we are also, just another little aside, we're hiring another Measure O staff person who will take this role over from me and will be the person working with the chair. I assume we will do a little meeting and go over the agenda. The chair and the staff person from the department will work together, just plan meetings, make sure everyone's got what they need, and then run the meetings, call the meeting to order, call on hands. Like I see Ernesto has his hand up. Ernesto, are you volunteering to be the chair?
Absolutely not, Lee, but I am going to nominate Shirley Zane. I think of all of us, I think she's got that working knowledge of what this is about. She was very instrumental in pulling this together, help get it past that extra 1% that was needed. Overseeing a county budget of almost $2 billion. So she's got it. Prior work on the nonprofit, et cetera. So I would like to nominate Shirley to be our chair.
Thank you.
Thank you. Gregory has his hand up.
You're muted.
You're on mute.
You're on mute. Unmute. Greg.
Try-
Yeah, there you go.
I'm hitting a little arrow in my box and not down on the left-hand side. Sorry about that. I wanted to second Shirley's nomination.
Thank you.
Shirley, do you accept this nomination?
Um, yeah, I told Ernesto I was really happy to be out of politics, which I really am. But when it comes, this isn't political. This is about how we're going to make these investments to really make an impact in our community. And I have a big vision for this, just to forewarn you all. I think $25 million should be the start and not the stop. I think there'll be ways to move forward, and we can lobby together as a committee with our state and federal representative to leverage that funding through SAMHSA, through state. You know, I don't think that we have ever been at a time that we haven't recognized so personally with COVID, how mental health and substance abuse affects our lives every day. So I have a big vision for this. And I also understand that being the chair is simply orchestrating a meeting and to shut up and let other people speak. So that's the type of thing I want to do.
Well, excellent. Do we have any nominations or volunteers for a vice chair?
No, I'm not volunteering again. I'm going to nominate Betsy Chavez to be our vice chair.
Oh, awesome. I'll second that.
Everyone's in agreement. Betsy, do you accept this nomination for vice chair?
I appreciate the confidence. I'm happy to accept. Thank you. Thank you, Ernesto.
All right. Well, I'm going to consider Ernesto gave a motion and a second for Shirley as chair and Betsy as vice chair. We're an informal group. This does not need to be super formal. Would you like to just do thumbs, or would you like to do roll call votes? Thumbs.
Thumbs.
All right. Are we all in agreement with Shirley? Okay. So, yeah.
Guess I'll vote for myself.
Okay, wonderful. Thank you. That motion passes. Chair Zane,
Yes.
we are now going to review the bylaws.
Yes.
I also just, before we do that, I did send out a Brown Act training. I don't care if you watched it or not, but does anyone have questions on the Brown Act, why we are a Brown Act meeting and what that means? We're all familiar enough with the Brown Act and we can move forward. Okay, great. So the bylaws, please hold while I pull them up. Did you have a chance to read the bylaws? Can you see my
Yes.
screen? Or are they on the screen? Cool. Okay, thank you.
You know, Leah, I think they're really pretty straightforward, but there may be places, as is the case with all bylaws, where there may be some interpretation to issues in terms of how we apply them. So I'm just, I want to encourage us to be able to have those open discussions when they come up. There's still an application and interpretation issue in bylaw.
Thank you. So we already went over the role of the committee. It's to review the receipt and expenditures of the revenue from the transaction and use tax, including the county's annual independent audit. The review shall be completed in conjunction with the county's budget process, and the committee shall produce an annual oral or written report on its review, which will be prepared by staff, and you don't have to actually write a report, don't worry. I think we went over most of these things. Let's see, what else was I going to talk about? Your members for 3 years. You serve 3-year terms and attendance. So we'd like you to be at all meetings and for all of you to be at all meetings. But of course, if you can't, that's life and that happens. But if you do miss 4 meetings, we basically consider that a resignation, and the board will appoint someone else.
Leah, there is a little inconsistency between when in the bylaws it says at least 1 meeting per year, or more if we choose to. And the agenda, which said perhaps we ought to meet the second Wednesday of every month. So I guess my question is, given what you've described and what we've read about how really little there is for us to do, and given the fact that it's there is, in my mind, a little bit of a inconsistency with the timing. It says that we're to do it in conjunction with the budget hearings. The budget hearings are usually in, April, May, June. That's a little late for us to be reviewing the previous year. And the value of a previous year report at the time when they're trying to put together the next year, you're a year behind. I just wonder about those things. And they're all in the bylaws. That's why I'm bringing them up.
I think
Thank
that's,
you.
yeah, thank you, Greg.
Oh,
I
go
want
ahead.
to say the same thing also, Leah, that the timing of that is off, and we really should be looking at these in April, just in terms of giving a report to the board about the budget. So thank you, Greg, for bringing that up. It's really important.
So I set up the timing as for, it could be 2 meetings a year or up to 4. So this meeting is kind of an off timing just to get us started. We wouldn't, and if we have to reconstitute and have a new group, we might do that again in 3 years, but we probably wouldn't meet in February again. But the meeting schedule I was following was the same meeting pattern that the Oversight Committee for Measure M follows, the Parks measure. And it does obviously need to follow the budget process. I'm sorry, I never meant to mean that we would meet monthly. I think I was just saying, does this second Wednesday or the first Wednesday, whatever I said in the agenda at 4:30 work for you? But would you prefer to meet 2 times a year or 4 times a year? Is there a preference on this committee?
Well, I'm sorry, but to me, Shirley's right. The timing of it and what we're presenting is important. You mentioned earlier, and we've seen the little financial report that you presented, and it looks like, now we're sort of responsible for the money that was spent before June 30th, 2021, almost 9 months ago. That audit is in. We know what it is they spent. You've given us a little snapshot of it, but it's really, quite old. If we're going to be trying to give advice and or a report to the board for the 22-23 budget. And so my question is, if we're limited to something that was closed a year ago, while that's an interesting report, and in this case, it's only 3 months, so it's not that interesting. I would be trying to catch them up on what happened between July and now, if we're really trying to help them project the future needs, and or if we're just trying to tell them that it was spent right. The question of what kind of report we give, you said we're not really responsible for doing a report. The bylaws says we could do it either written or oral, but I can't imagine us simply saying, here's a staff report, we think it's okay. So I guess I'm asking timing, and I'm asking what content we're really going to be talking about.
Okay, well, the timing.
How many meetings to me, because it's sort of the depth to which we want to go into this.
Can I add also to that, and thanks for bringing those issues up, and it'd be great to hear from everybody. I think that the complexity of these programs, I'm a mental health person, and I remember learning up until my last year in office for 12 years, things about these services. They're pretty intricate, and hopefully they're integrated too. And adding more funding to these programs is going to make some changes in terms of how we address mental health, substance abuse, and homelessness in our communities. So I want to get a little more into the weeds. We're not making the decisions in terms of where the money's going. That's all done by the board and by the measure. But I think we have a really golden opportunity here to educate the community on some of these services. And I think we should seize the day and not, just say, oh, here's our rubber stamp report. But feature a few of these services at each meeting and let the public hear about them. We're all going to learn so much. So I'm going for that approach now.
Okay, and Ben has his hand up, and Ernesto. Shirley, do you want to take over as facilitation, or would you like me to keep doing it?
I can go ahead and take it over. I'm just not always seeing the hands. Oh, now I see the hand. Yes, Kevin has a hand up. And then who was the second person? Orlando?
Ben and Ernesto.
And Ernesto.
Ben
Okay.
and Ernesto.
Okay. Okay, go ahead, Kevin. Yeah.
Okay, thank you very much. Sorry to jump out of queue, guys. I really appreciate that idea of making a little noise about the good we're doing. One of my concerns with the continuum of care is, most people in the county don't understand
Mhm.
what's going on with homelessness. They don't think anybody's in charge. Think there's a path to a solution, and that's just a lack of outreach to the general public. And so I would love the good of this program to be voiced, and so the public could see that we're doing something. And then second, and that their quarter cent is efficiently, wisely spent.
Mhm.
Second part is I would like, rather than just dollar metrics, I would like to see some performance metrics,
Mhm.
able to staff up this or this, and wherever the money goes, the value of that money should be included as part of the report back, included body, and if possible, not just in a volume sense, but in a quality sense, or an efficiency sense, any of those things that are, if we want to make substantive change, we have to do something that's sort of groundbreaking, and scaling programs is good, but improving programs is even better.
Mhm.
You're here.
Okay, so who was next? Was there Ernesto? Yeah.
Ben, I think.
I think,
And Ernesto. Okay, yeah.
thanks. I appreciate all the expertise in these areas that's represented on this committee. I'm a little worried about conflating the job of this committee, which is reviewing the expenditures of the previous year and confirming that they match the intended, what the voters approved, with an advocacy group that's advocating for broader services or something like that. I'd be quite comfortable with us taking on a broader educational role, as Kevin put it, that's about, what good this money is doing in the community. And that's I think consistent with our charge. Whereas I think trying to see this committee as one that's going to, somehow make county mental health and homelessness services better, that's the wrong committee for that.
Ernesto?
Thank you, Madam Chair. I think that every opportunity we can get, we should be talking about the programs that are being provided to the community. Eventually, maybe we'll get down to 2 meetings a year, but I think initially we need to ramp it up a little bit, because even for us as a group is to be educated about the kinds of types of services that can be provided, so that when we're talking about the expenditure later on, it's in context for us. We know what we're talking about. And along the way, the community is also going to learn along with us too, because it's big. It is a lot of money, and we need more money. And the services, they vary, and we all have knowledge and expertise in certain areas, but to really get a better understanding of the types of services that are being provided will be very beneficial to this group and the community. Even though we're not going to be meddling into how those are done, we're looking at the expenditures. But again, it makes it easier when you're talking about the expenditures, when you know about the types of programs that you're talking about.
Yeah, exactly. So let's see, who was next after Ernesto? Anybody else? Betsy or Orlando? Haven't heard from you guys yet. Want to jump in there?
Orlando's hand was up.
Oh, Orlando, there you go. Go. Oh, I see it now.
My hand really matches
Really?
the paint next to my hand.
It's
so
really, you do have a light hand on your.
I've tried to make my hand dark, and I can't figure out how. So, but I actually really like Shirley's sentiments, just about seizing the opportunity. And I hear that that's not the maybe it's not the focus of this group, and understand that, and that, you know, some education might be the focus, but I also think it's important, you know, it's just it's a really important vision to have. So I do appreciate that. And I also appreciate Kevin's, you know, conversation about the value metrics, because I think it's so easy to throw money, and I've seen, you know, so much money being thrown at mental health things and nothing improving, and then more money being thrown in a certain direction and nothing improving. And so I don't really understand the how much the focus of this group is to do that sort of thing, to judge the value, or if we're just really supposed to look at the financial aspects. But I do think it's important whether or not it is a focus of this group. So thanks.
Okay, thank you. Betsy?
Yeah, I think I agree with much of what has been said. I think it's important to bring in studies that are community-based, that are asset-based, such as Fortalezas, the Portrait of Sonoma that just came out, to leverage what we're doing to inform the work that we're doing, and to the point of highlighting programs out in the community. I know there is such a need, a greater need, to have community understand the resources that are available to them, especially our hardest to reach communities. But I think we can work, if possible, as an entity, perhaps with programs to reach these folks, or in collaboration to help them reach folks that are in need of knowing of these services. I'd really like to see us meet those 4 times versus the 2 times initially, to really get the ball rolling, to have a good sense of what the group's goals may be moving forward, and to really strengthen them, and to have a community know that we are being held accountable for the choices that we're making, and for, you know, the guidance that we're providing. I think that's important. And how we inform the community of what we're doing, how we're doing it, I think is important as well. So those are my points.
Yeah, thank you. Thank you, Betsy. I would want to add also, somebody who wrote way too many United Way grants over the years, and I know some of you know what I mean. They changed their grant writing process, and we kind of followed them at the county years ago, from going from outputs to outcomes in the community. And I think that's a really important point as we approve these expenditures, is we need to understand how our community is being served for the greater good. And these services are really life-saving services. You know, we're talking about the brain, we're talking about our most important organ, the, you know, diseases of the brain. So I think it's important that we do understand these well in order to approve the expenditures. So maybe, for instance, we give, or the board gives $100,000 to peer support programs. What do the peer support programs do that make families and make people who are struggling healthier? You know, understanding that, you know, how those dollars get invested. And so I think what you said, Kevin, about the whole idea of performance metrics is really important too, that we look at that. You know, I think what we decide here at this committee is going to be important. And you know, when we wrote Measure O, we really looked at why we needed to have citizen input. And because, you know, there's going to be a lot of people that are going to want to know, you know, why are you giving so much money here? Blah, blah, blah. You know, it's always that. But we have to be able to justify it if we're going to approve these expenditures. And it's exciting to be able to approve $25 extra million, you know, in terms of how that affects people's lives. That's pretty exciting. So thank you all for your comments. I want to say they've all been excellent. And what you said also, Ben, about the educational role, I do want to emphasize that. Some of us are going to naturally be advocates because that's what our DNA is, right? But the educational role is really fundamental, I think, in terms of this committee. So are we all in agreement? And
Yeah,
go ahead.
Sure. Yeah, I want to make another comment on that.
Sure,
Too,
and then Gregory's
just to support this conversation, because I think to make our job more meaningful, we need to know that there is an evaluation process that is being used consistently, right? I think that's important. You know, it's kind of like some of us still balance checkbooks, right, at home, and it balances out, but the expenditures that we've made, sometimes were they needed, right? We have to question that sometimes too. But I think just again, not getting into the weeds, but just knowing that there is a process in place for evaluation and that it is being done. I think that's important.
So Leah, that would be something you would want to come back to us on and review. And I think it's really important.
Absolutely.
Yeah, because I know, so thank you, Ernest. So Prop 60, was it 63 or 65 Mental Health Services Act? I always get the numbers mixed up. What number was that?
3.
3? Okay, Prop 63. I had 2 programs at the Council on Aging that got funded, and I think there was 7 years that went by without any evaluation process. Not to speak bad against the county, Leah, but I think everybody was just trying to figure out what to do, and there was no evaluation process. So I think these programs we've got to have that evaluation process in place. So maybe if you could come back to us and maybe review that, maybe even on our next meeting, if that would be okay, Leah. And then I wanted to let Gregory say, had his hand up. Let me let Gregory and then go back to that. Okay, Gregory, yeah.
Yeah, there's just 2 things you should know about where I'm coming from that dovetail in what you're talking about. One is something I've been fighting within the philanthropy community for a long time called results, either results-based accountability, which the Human Services Department is trying to apply to the ARPA funds, or empowerment evaluation, which is the term we gave it a long time ago. And it has to do with a partnership between grantor and grantee. And it says basically, you're in it together. You should try to make changes as you learn them, as you learn lessons. You shouldn't be this sort of distant, sniper at what everybody's trying to do. The second thing is back to ARPA. There is another huge pot of money and a bunch of people in this county who are trying their best to do some new expansive programs aimed at folks who were affected by the coronavirus. I'm on the review committee, I'm on the working committee, and we're trying our best to apply those funds. I think we ought to try to, blend this, both mental health and ARPA have to be seen as 2 big stimuluses to how the county does its job in helping the community address the issues.
Can you define the
so just know
ARPA in terms of it's an acronym, Greg, can you define it?
It's called the American Rescue Plan Act, ARPA. It's $350 billion that's going out to 4,764 cities and counties. And we're 6 months into the process now, but we're very close to issuing RFPs that will help people understand what they can spend it on. And we've made a serious effort at trying to help people learn how to evaluate. This isn't going to be sort of like go for the money, go away, and then come back a year from now and tell us that you did it right or wrong. This is and it's primarily focused in the Office of Equity and in the Human Services Department, but health services should be right there too. And we should figure out a way of trying to get this 2-prong effort to not be in silos. So let's try to do that.
Great suggestions. Thank you. That's wonderful.
Sure. I just wanted to add that these are just a couple of examples because we talk about how often we want to meet. There may be other things that we need to learn about, get educated about, not make decisions about, just to learn. And I don't know what, but that may need us to have those meetings just to learn about that. It could be calling somebody in to teach us something about some of the process that we're talking about. And they don't come to mind right now, but I'm just saying these are just a couple of examples that we've already brought up.
And I think that's great, Ernesto. I had the same type of a vision too. And thank you for using the word empowerment. Again, taking away that paternal type of relationship that's traditionally there between the grantor and the grantee. It would be great if we could have the people who actually, Ernesto, you were saying this, have the people who actually provide the services come in and talk to us a little bit about what they're doing and why they're making a difference and why Measure O has made a difference for their services. So that would be good. Okay, any other hands on this particular issue as we're looking at kind of how we are going to approach this? And then Leah, if you want to jump in there too about helping us with that and maybe helping the new Measure O staff member. person too, yeah.
So I think what I'm hearing is that you'd like to start with 4 meetings a year, which is great and fine. And we already had planned on bringing some programmatic staff to, and they may be county staff or they may be partners to come to future meetings and explain to you what their programs are and how Measure O is contributing to the work that they're doing. And many programs already have evaluation built into them, but across the board evaluation specific to Measure O, I can't say that we've had that conversation yet. And I am very familiar with RBA. We do a lot of RBA within the department. So I can take all of that back to the staff and, you know, figure out the most uniform way that we can apply evaluation across Measure O programs. The Measure O is a lot of different things. It's not, you know, it's not one thing. So it will be complex and exciting, and I will carry that message definitely, that you would like to see some evaluation measures in place. I definitely agree with you. Kevin, did you want to say something?
I don't want to interrupt, but
No, go for it, yeah.
thanks. I would love to have a simple primer on what the web of mental health services is, and you know, what some sort of who links to who, and just from zero to you know, to up to speed, quick and easy. Thanks.
Okay, that's definitely doable. Thank you.
So,
Okay,
can I, Elia, the other thing I wanted to just touch on, because I think Greg raised a really important topic, is, again, how do we maximize these dollars in terms of this other massive fund that's coming into this county? So I don't know if we could have, to get the expenditures from, did you call it ARP? I'm not good with acronyms, ARPA?
ARPA. Mhm.
ARPA, but I think that would be great if we could bring that to the meeting to kind of see how those funds are being leveraged and the programs that our whole community is investing in.
Great idea. Okay. Hard to take notes and answer questions. That's why we need a note taker. Okay, so back to the bylaws, which is the agenda item we're currently on. If we're, this doesn't need to be in the bylaws because we can have 4 meetings and then lower it down in future years if we would like to, but I do need the bylaws approved. So are there any other questions specifically about the bylaws that you would like to go over?
I don't think it doesn't look like we have questions. I would just add that as we move into more the committee work in terms of oversight, that there might be things that come up for us in the bylaws we might want to discuss. So I'm just kind of an open door person in terms of, you know, discussion. Anything new is always going to be an evolving process. So I'm just going to say, I think we want to evolve, and no, we're not going to change the ballot measure, because that's the essential here, is that we don't change the ballot measure, that we respect what the voters passed, but to allow for discussion as we continue to move along this process. Do you want a motion on approving the bylaws, Leah? Yeah.
I
she
do,
does.
yes.
Okay. Somebody want to make a motion?
Kevin has his hand up.
Okay, Kevin.
Well, I had one more question for Leah on this, and some bylaws define what it takes to pass something. There's a quorum category in there. Should we add a sentence that says, you know, 4 votes or a majority of them attending is enough to pass something? What is the board's thoughts on that? Commission's thoughts?
My thought is, since there's just 6 of us, we should make every effort possible to accommodate our schedule so that we're all here, because the people who are sitting around the table have such important voices, and I would hate to have even one absence from somebody. I think that will absolutely affect our process. So we can do the quorum or majority vote, that's fine. But I think we need to really make an effort to accommodate everybody's calendar so we can all be together as much as possible.
So a simple majority is an approval. Things pass with simple majorities. That's understood.
Yeah, yeah,
Okay.
yeah. We're not doing a filibuster, no.
Ben has his hand up, Shirley.
Okay, Ben, go for it.
Thanks. I had a question, I guess for Leah. Are the bylaws a document of this committee, or are they approved by the Board of Supervisors or anybody like that?
That's a great question. So they have been approved by the board, but they're also to be adopted by the committee. So if you had changes, we could bring it back. I don't know that would need to go all the way through the board, but we could have county council review and just make sure that they're acceptable changes. Thank
Well,
you for the question.
I'm comfortable with them as they are. I would encourage everybody to make sure you read Article 4, because with people's, there's so much expertise on this committee with people tied in so many places. The conflict of interest, as it's described there, may come into play. Like for me as a city council member, or for anybody with nonprofit ties. But I'm moved to approve the bylaws.
Okay. Do I hear a second?
I will go ahead and second that, and just with the added comment that, this is the first blush at the
Yeah.
bylaws. I think if we do see room for improvement through the course of the year, we should offer that up so that they can be amended at some point as well. So I second that.
I agree. Okay.
Thank you.
Any opposition to that? Or are we all okay? Okay, great. That has
Good.
passed. Okay, great. And I'm getting trained now and looking at your hands. Speaking of looking at our hands and looking at our faces in Zoom, do we want to try and meet in person with masks and safely distancing when the health order changes in a week or so? I would prefer to meet in person, but I'm over Zoomed myself, so probably all of you are. So
I for one am happy to go with whatever the current policy or protocols are for the county. And if it's allowed us to meet, I'm happy to meet.
Okay.
Option is, does the county have a hybrid protocol put in place such that, you're still on, the public is still on Zoom, and even though the commission is all seated together? Is that a county process that can be facilitated at this time?
Leah or Bet or Susan?
You're saying, can some people be on Zoom and some people meet in person? Is that the question, Kevin?
Well, yeah, that's all different permutations of hybrid come into play. And some of the commission be in chairs together, and some on Zoom. But more importantly for me is, can some of the public be in person and some of the public still have access on Zoom? So I would say our goal is to move to the county's hybrid model as we're certain it occurs.
Okay.
Move with the county.
Yeah, I think the real challenge there is having some of your public in person and some of them, on Zoom. So I don't know, we'll just move along as it comes. I mean, COVID is all about one big experiment as the waves of this disease is. So, and you guys are on, we've got 3 members, and Ernesto just went off the city council, so you've all experienced this. Ben, you had a comment?
Yeah, thanks, Chair Jane. I was going to request that if we're going to meet 4 times a year, that at least 2 of those perhaps be by Zoom. I mean, it's an extra hour and a half of my time to make it up to the county offices and things like that. And I probably couldn't make the full meeting because Wednesday work goes too late. So to the extent we can hold some still on Zoom, that would help me out.
Okay. Well, if we're going to meet before May or June, if we're going to meet in April, so we can have some input in terms of the budget process at the county, then it would make sense to have our next meeting on Zoom, and then maybe the following meeting, as hopefully COVID gets better in the warmer months, maybe that meeting in person. What do you think about that, Leah?
I think we can make whatever the will of the committee wants. I do know that meetings where part of the group is in Zoom and part of the group is in person are challenging to facilitate. So we might want to try to all be in one place. The public is the public, and we'll make accommodations either way. But for us to talk effectively, I think it's it's difficult when some of us are not in the room and some of us are. So, but
Yeah, I think, Madam Chair, I think our response to availability for this meeting was based on Zoom. So if you said we're going to do it live, would people's answer be different? I don't know.
Yeah,
right.
okay.
And looking at it in the long term, there's a significant number of people around ARPA funding who are trying to move the needle on just communication, getting more people who are aware of what's happening at the county and at cities. So there'll be some money spent on, I'm sure, trying to help us all figure out the technology of all of this, but we're not there yet.
Yeah. Other hands, other thoughts? Betsy, I see you down there nodding. Do you have a comment or in terms of what works for you on this?
I'm flexible. I think Zoom for the time being for me works well. But if in the future a sit in person would work as well, I think that there's benefits to the in-person option. I think given the current circumstances, also if this is going to be a public meeting, it'd be great to be able to advertise it with a good amount ahead of head notice, so that people can attend.
That's a good suggestion. And if we're going to have somebody, present a program or service at each meeting, I think that would be also a good thing to advertise to the public, that they might want to hear that. You know, again, going back to what you said, Ben, in terms of the educational piece that we have here. Okay, any other hands? I see Orlando, and then I see Kevin.
Yeah, I just wanted to add my 2 cents. I think that it would be nice. It's always nice to meet in person. So I like that idea. And I kind of like the hybrid idea of maybe a couple meetings on Zoom and a couple in person, maybe going back and forth. And I think it's always nice. I like just maybe the implementation. You know, I think one of the good things about COVID with regard to the public and a hybrid is that it just has increased accessibility for people. And there's a lot of people who, you know, for various reasons, can't access in-person meetings. And I know North Bay Regional Center was talking about that, one of their past board meetings, just how it's really nice, kind of, one of the nice side effects, I want to use that term lightly, of COVID, is that, having people come into Zoom has created more accessibility. So I think it's just a good idea to think of from that aspect as well for the public.
Thank you. Good suggestion. Kevin?
We haven't discussed what the physical venue of this committee would be anyway. And I was going to vote for the CDC's offices, Guerneville Road. It's closest to the SMART station.
Yeah.
Most convenient for mass transportation.
That would be a good one. I think there's several. There's the HR training room at the county center also. And then the rotunda is no longer, right, Leah? So what's the health services meeting rooms these days?
Honestly, I haven't done an in-person meeting in so long. I don't know where I hold one. Our meeting room at Neotomus is, I don't know what it is. It's being repurposed. So I'd have to figure that out, but it's a challenge I can completely handle. So
one of the best meeting rooms, because I used to have lots of committee meetings there that involved people outside of the county. It's the sheriff's office. The sheriff's office has a great, huge meeting room. So that's maybe a possibility as well.
It might be a question of the technology of each of these meeting rooms.
Yeah. You got to have.
I was just advocating for smart train accessible.
Oh, good.
That's why CDC on Guerneville, right?
I think that's
you're right.
That's a pizza accessible spot too. Might want to have
we would want a room.
Yeah.
We'd want a room that was equipped with Zoom technology so we could all see people on a big screen and have cameras so people could hear us all. So that is a consideration we'll need to keep in mind.
That's good. Great.
Betsy also has her hand up.
Okay. Oh, thank you. Yeah.
Sorry, just also to point out that I forgot who mentioned it, but there are nonprofits who have benefited from the Zoom platform because they are just so shorthanded. There's a lot more that have come into the rooms for us to understand what they do, because prior to the pandemic, they've been boots on the ground, so occupied that they have not been able to elevate their programming because of the lack of time, because they spend a lot of the time working. So I think to honor those that don't have the resources to provide time to educate our community about what they do, or even committees like ourselves about what they do, that offers a good outlet for them. But also thinking about the venues that have been beneficial and have been well attended by community members, or will we think about maybe being able to be broadcasted on Facebook, for example? So a Zoom meeting on Facebook, I don't remember if I know the county has done something like that. I think community members have learned how to access that and have been attending forums that have benefited their knowledge. I wonder if that's something that we could do other than YouTube and the traditional Zoom to add that.
I think, Betsy, that's a great suggestion. I know the Board of Supervisors did a lot of public forums on Facebook during the fires and during COVID. So I know that's possible. We just have to get a IT person to provide some assistance to it, but that's a great suggestion. I want to add too, and you've all been talking about accessibility. During, again, COVID, doing things on Zoom has been great, especially for people who don't like to drive at night, like seniors. It's a big issue for seniors to be able to come in on a meeting like this, and they don't have to get into their cars and drive at night. So there's a lot of good advantages both ways.
It's also great for simultaneous translation services for part-time folks who can get around. Yeah, I don't want to advocate totally for Zoom, but I found that it opens up dialogue enormously.
Yeah, good. Okay, Leah, any other comments about this? And my printer.
We may be overestimating the public interest in the Measure O Oversight Committee, but I appreciate everyone's excitement.
No, not at all.
But I just want to clarify, we're looking at 4 meetings a year, and I also want to just engage Susan in this conversation to make sure it makes sense on a fiscal level. So you're requesting a meeting in April, and then I think for fiscal, what makes sense for us throughout the 2022 would be August and November to look at the financials, prepare for the report. Susan, does that sound right?
You would meet in August to review financial information, or for the
Yes,
year?
or
I
would we
guess it
only
just
do
depends
that
on
in
when you
November?
wanted to, how often you wanted to meet. Yeah, it's just that our year end, we work on year end in July, and so July, so meeting in August, it wouldn't really give us a whole lot of time to prepare anything.
I agree. I sit on lots of audit committees and lots of financial review, and August is just far too fast.
Mm-hmm.
Exactly.
But
And Ben
I'm
has his
sorry.
hand up.
Yeah.
Ben, go ahead.
So strictly speaking, our expenditure oversight role, I don't think takes more than 1 meeting. But we've talked a lot about I could certainly use education about this network of services. And so an August meeting that's not got anything to do with financial oversight would be great. That meeting could be exclusively focused on some providers coming in or county staff helping us understand that network. So it still might be a good time to meet, but not ask Susan's department to have reports ready by then.
Yep, you got it. I agree.
That's good. That's a good time.
Okay, so then November for the financial reports, that's when the big fiscal review will be. Is that correct? That
So
works for everyone and that works for fiscal.
it's, that's a little confusing though in terms of fiscal, because the county budget really is still from July to June. But you're saying that that's what's always confusing. But this particular measure is on a calendar year. Is that correct?
Oh,
The reporting is on a fiscal year. So all
Yeah.
the reporting will still be on a fiscal year, just like everything else at the county. We have 6 months, the county has 6 months after the close of the calendar year, close of the calendar year to give a report to the board. And it's all meant to go within the budget process. So I want to make sure it works for you guys to have enough time to look at things, and it works for fiscal to the timing lines up. So I may need to go back to the powers that be and clarify with them what works for them. But I also want to know, just as you said, and Ben's great suggestion, if we have a meeting in August and we just look at programmatic things and we get to educate ourselves on the good work of Measure O, ask questions there, and then have a fiscal review. I just want to be clear on which months I'm targeting meetings. And Gregory has his hand up.
Gregory?
as hard as it is, I want to push it back even further. As I said before, and I think you agreed, Shirley, it's really the month of April that you're going to have the most impact on the budget. Maybe early, but not November. And so, and I don't want to do this twice. You really, what we're learning about the programs and what we can learn about any other things can happen between September and March. But if we're going to have a time in which we're going to, dig deep into what I remember hearing when we were doing this, transparency and fiscal accountability, which is our primary thing. We've got to be delivering a report that is both retrospective and prospective in March and April. And that's the primary time when we're going to have the most impact, have the most capability of informing people. We can have other meetings before that talk about, performance and evaluation and the kinds of things that we, might want to do that goes deeper than just fiscal. But our primary task is to deliver a report consistent with budget hearings about fiscal accountability, and happen at the time when people want to hear it on the board, and the community wants to give given a kind of a report card on what we've we're up to. So I think the fall is not the time for doing any of that. The fall is, about learning and about, maybe making changes based on what the previous board decided in the budget hearings. There might be some things that, that our words help bring about. And we could then spend this, the fall, if we want to, learning about, how it will impact the future, so that we're prepared to see whether it did in the spring.
Yeah, I agree with that. I think, again, the budget process is pretty quick these days at the county. It's usually goes for a week. It used to go for 2 weeks and on, but things are a lot tighter these days. And so if we are going to have, have some input over this budget, it really does need to be, the meeting should be in April or March, but, May and June is almost too late. So, but we've got the rest of the year to educate ourselves about some of these programs. So I think, yeah, go ahead, Kevin.
Thank you. I kind of see it the same, but maybe nuanced differently.
Yeah.
I had felt that the November would give us a chance to reflect on the prior fiscal year. Certainly the numbers are all coming in, closing out, even audit times are there. And our surety is to, make sure that money got spent and to be able to acknowledge where it got spent. And then I see the April meeting as any recommendations we might have to the budgeting process. So I see them as two different functions, both equally critical. One assessing the prior fiscal year, and then one recommending it. And any time in between can be for all the discussion of effectiveness and any other discretionary conversations we want to have, education, et cetera. But at least we get a snapshot of the year-end closing come November, and our output recommendations to the board in an April meeting.
Other comments about that in terms of timeline?
This is Ben. Clearly, some of you have a more expansive view of the role of this committee than I understood, and that's great if we can figure out a way to square that with the the Measure O language, which to my reading gives this committee a fairly limited role, which is basically confirming that the prior year's expenditures are in accordance with the ballot language. There's not a role for this committee in having influence on expenditure decisions. In fact, that's explicitly ruled out as a role for this committee. So I think if we, to the extent we can think of our role as educating the public on the good work this fund is doing, I think we're in conformance with Measure O. If we think we're going to hold a meeting in April to make recommendations to the Board of Supervisors about expenditures, I think that's out of line with the Measure O language. So I think we got to be careful about how we think about our role. We could, our report is allowed to have conclusions, so it can say, we think the money's being spent inefficiently, and that can be read as a recommendation by some, but I think our role is not to explicitly make recommendations about funding and try to influence the budget in that way. So, and the timing that the Measure O language gives the county departments until the end of December to produce the report that we're supposed to rely on in reviewing the prior year's expenditure. So we can propose we meet in November, but technically the departments have until the end of December to produce that report. We have a similar, oversight committee for our local sales tax in Cotati, and that group always meets in January because the language requires the report to be ready by the end of December. So it seems to me that January is a better month to aim for than November for reviewing the prior year's results.
Yeah, I agree with Ben. I've been on too many audits that weren't done by November or December.
Yeah. The timeline's really critical.
It's
Yeah. You're fading, Greg.
Ernesto has his hand up.
Oh, Ernesto, sorry. Thank you.
No, it's quite all right. I was just going to also stress what Ben is saying. We need to stay focused on what our charge is by what the intent of Measure O was. And what I was saying earlier on was, what information do we need to educate ourselves to go through that properly? It doesn't mean getting out into the weeds and start, getting into other things that are not within our purview. It's kind of like maybe sticking your nose in but keeping your fingers out in certain situations, right? So the information is good for us. They put it in context, but I think at the end we need to really stay focused. And Leah, who's going to be doing that for us? Who's going to be keeping us within our lane as we move forward? It's important that somebody's there to do that, so we don't, do an oops and kind of go beyond the scope of our duties too.
Well, I think in the future we will have some fiscal leadership here that will definitely be able to tell us, what the timelines are and what works and where your input is and isn't. That is less my background here, but that's why I suggested the timeline, that because they're the county and they're also a sales tax, the schedule that the Oversight Committee, which we really modeled ours off of for Measure M, for the parks measure, is to meet in February, May, whatever it was, something in November, August and November. And they do the same thing. They do some education, and then they look at the fiscal overview twice a year. So we can go along that schedule, or we can request something different, and the fiscal department will let us know if that works and what reports we'll see at that time. But that is the recommendation from Parks, is to follow that. It's working for them, and I can show you what their annual report looks like, and just so you can see the type of materials that their committee is contributing to. And Gregory has his hand up, but that's the way I know it and see it to be. But I'm definitely open to taking back to leadership whatever concerns or questions you have to do it differently.
Yeah, because I don't think we're going to be able to resolve it tonight, and I think going back to leadership to ask those questions, and to the extent possible, I would include our chair and vice chair in those offline conversations, so that way a recommendation can come back to us on what our path is going to be in timeline.
Yeah.
Okay.
Greg, you had your hand up too.
Yeah, and if we follow our own advice, it's February. We have an audit that was finished by December 22nd. We have a projected plan for the Measure O delivered last July by the county administrator. What I did prior to this meeting was to figure out, okay, so what is this financial report that we have on the agenda, and how does it relate to the audit that was made of the county funds? Where is the behavioral stabilization, behavioral health stabilization fund is what this is called. It's in the budget. And I had a quick question, which I hope somebody can answer in the future. We have a report in front of us in the agenda that shows $536,000 came in the 5 categories. They've spread it by percentage, and 271,000 that went out, and it's basically just a percentage of the top thing. We should have been getting $6.2 million between April 1st and June 30th. If we're going to get 25 million a year, and the tax started on April 1st, there's a whole lot more than $536,000 that the county's gotten. If we're going to do what we just said is our role, I want in the next couple of months a really good analysis of our budget, of our audit, and of the projected of the expenses, so that we can do our job. And this little 536, it does nothing for me.
Well, I'm glad you're bringing that up, because it's almost 6 and we need to talk about that report.
Yeah.
So
Yeah, go for it. Yeah.
Susan, would you like me to pull it up?
Oh, sure.
Are you ready to go over it?
Yeah. Okay. Yeah, so we have to take a look and see again, because I think it might have been slow in the reporting. So this is just the receipts that that we've received through June 30th. So we received $536,000, and then we paid, if you can scroll down a little bit, the $271,000 we paid to the registrar of voters for the election costs. And this report is going to look different in the future. It's going to have, it'll show the fund balances for each of the separate funds, and then there'll also be a report showing the operational expenses and other revenues that come in besides Measure O. So this will look different in the future.
Yeah, but
And to clarify, this was just for the first 3 months of the tax measure, because you don't start receiving revenue until April following a November election. And so this was for the first fiscal year.
But it even is confusing in that regard, because that little teeny, very small type says you're only doing April, because May and June were received in, unless this is cash basis accounting, it should be accrual. It doesn't matter when it came in. I'd like 3 months worth of full accounting of this money. And if it's only $536,000, we got a big problem. Because, so I want this to tie to the audit. I want it to be able to have a really clear track of how we can make sure that the money was spent well. Otherwise, let's go home. We're not doing our job if we can't figure out a way of defending what we are spending money on and how much we got.
It did seem way low to me also, Greg. So I'm glad you brought that up, and we do need some answers there. And maybe we need to go back to the tax collectors department and ask why we're seeing such few dollars if it's a $25 million approximation sales tax. I do want to offer some speculation that with COVID, sales taxes have probably taken a dive, just because people are not going out and spending money as much, or spending it online, so there is some impact there, I think, with the pandemic.
Sure, but if you read the audit, Shirley, it's saying we're getting millions of dollars into that behavioral health stabilization unit. The same audit for the same period ending June 30th is telling the board, and told it in December, that 5 different sources have gotten 48 million more bucks into the county. And they name the ones that are the biggest, and it's behavioral health stabilization, mental health fund, CARES. I just want something more than $536,000. That's a joke.
Yeah. Good point. So Susan, maybe you can do a little digging and get back to us on this, or do you have any thoughts?
Yeah,
Yeah.
that's what I wanted to say. Before you contact the auditor's office, we'll have to check and see, because I do not believe that we set up an accounts receivable for Measure O at year end, just because we were unsure of what it was going to be. So if any money came in that should have been reflected for last fiscal year, we've received it in this current fiscal year. So so we just need to look at that.
Yeah, but remember, we're doing an audit of the entire county expenditures for this fund, not that which you received over in the Department of Health Services. I mean, we need to make sure that, because if the audit says there's $100 million sitting in cash at June 30th, you know, and a big part of it is the behavioral health stabilization, you can't be saying something different, and we can't be saying something different. If I can find these inequities, anybody in the public can, and they're gonna.
Mhm. Okay, well, we will, so noted, and Susan's going to do some digging, and Leah, and then get back to us at our next meeting. I mean, those are the insightful questions that we need to ask right now in terms of these expenditures and how much money we're bringing in and how they're being applied in the community. So, you know, thank you for that. Any other hands? Kevin, let me call on Kevin. He's had his hand up for a few minutes. Yeah.
Thank you. I totally agree with Gregory there, and it was a huge red flag when we received these documents.
Mhm.
I'm glad to hear we're going to dig a little deeper. And then, did I hear you correct, Susan, that the $271K was a reimbursement for the actual for the measure, cost of running the measure?
We had to pay the registrar of voters for whatever work that they did on the election
And that
related to
money,
Measure O.
and that money came out of the proceeds of the success of the measure.
Correct.
Yeah.
That's standard. When a measure passes, you pay for the cost of that measure being on the ballot.
It's probably pretty standard for all those in the know for the intricacies of government, but it is not in the know for those who are out
Right.
voting for it or expecting to have the mental health benefits of it. And so I'd like it flagged a little larger. And when we see the expenditures there, we see them by the 5 categories, like it's proscribed, but we have no idea what's going on other than funds were allocated to boxes, and we don't know what the boxes did with the money. I think our role is a little deeper than just seeing the percentage rates.
Absolutely.
If the reports could be broader and more specific to what the expenditures are. Thank you.
So let me just add another question and comment, and hopefully we're not all being too cynical here. But the behavioral health stabilization, that's a new term. County's really good at creating terms for filling boxes, and behavioral health positions. A lot of them have been threatened at the county because we haven't had enough funding. But the voters were very clear when we put Measure O out there that while some of that money needed to go ahead and help stabilize some of those services that we were mandated to perform through the state, that there needed to be a big chunk of change that was going to go into newer programs also that were going to supplement the services that were already there.
Yeah.
So I would like a real definition of that category, because it's a new one, I got to tell you. Behavioral health stabilization, I believe it's called.
Yeah, fund.
Yeah,
That's
that is restricted for audits, any kind of audit paybacks that we have to the state. So that's what that money is for. And anything in excess of our reserve can be allocated to behavioral health programs with Board of Supervisors approval.
Okay.
That's not how the audit reads.
I think audits can be very.
Okay, yeah, I haven't.
Okay, I'm just telling you, there's an inconsistency. And one more thing for, if I can.
Okay, we'll have
Shirley.
to take a look at that
Yes, those-
then.
But those of us who also supported the tax, but were reluctant because it seemed to us and the homeless community that we were being used to be able to pass the thing in the first place, to end up getting such a small percentage out of it. There's a lot of people in the homeless community who are like you, thinking it should be expanding the services, not just simply backfilling into what we couldn't get from the state. Have still sort of like, well, what are you doing for me? And like I said, this committee is not about trying to resolve that issue, but I just want to let you know that we can't trip over ourselves over what we call it or how we sell it or what communications go out. People have to feel like this was a good thing.
Yeah,
Ben
I
has his
think,
hand up.
yeah, Ben, yeah.
Thanks. While we're on the subject of kind of what we expect to see when we get to a more real year, but what I had expected to see this time, the Measure O is clear. We're supposed to review the audit. We didn't get the audit. I'm glad Gregory went and found it, but we were supposed to get that. The audit should correspond with the accounting we get of how the money was expended, and it does seem like the report we got was on a cash basis, and so it claimed, well, we're only looking at 1 month worth of income. So those things need to be squared in the future. The expenditure plan in the measure has programs listed for each of these 5 categories, and I think we need to see at least that level of detail. We need to know not just that 40. Well, I mean, this report we got that shows 59,000 went to behavioral health facilities. That's and then we find out it actually didn't. It actually went to the registrar of voters to pay for the costs of the election. Even that is a little shocking to me. So I think we need to see where the money really went.
Yeah, I totally agree. And I want to second your recommendation in terms of the 5 categories. That's the important thing, that we have to make sure that the voters' will is being fulfilled in terms of these categories, how this money is getting expended. But I would also add that fiscal language and government language often excludes the public because it's just complicated and we don't define terms and we use too many acronyms. So to just ask our staff people, Leah and Susan, to help define those terms and to be as inclusive as possible. So any member of the public could pull up some of these expenditures and say, oh, okay, I get what that is. I know where that's going or how much money. But I think if we can see a monthly flow, a quarterly flow, a yearly flow, that's how I used to do budgets when I ran the Council on Aging. I don't, just this looking at what's happening on an annual basis is kind of limited in terms of how money gets expended. So, but at the very least, we want the categories and the percentages. Okay, what other requests do we need between now and our next meeting? Because we need to get that audit. And again, I'm glad you found it, Greg. I don't think anybody else found it on the committee, did they?
No, I did not, Shirley. And yeah, I just wanted to clarify that too, because I think some of these definitions of these 5 categories are someplace, not here. So when we have them in front of us and the public's going to be involved, we always have to have, what does it mean someplace along our agenda so we can clarify that for them. Because again, we're using terminology that we need to learn and the community needs to learn too. But yes, thank you for bringing that up as well.
Mm-hmm. Yeah, thank you. Any other hands or comments on this topic? And Susan, did you have some other things that you wanted to share with us on the expenditures?
No. We're just gonna have to go back and do some research and we'll get back to you.
Okay, but if we're going to meet in April, yeah, we do definitely need to see that audit as soon as possible, and any other financial information that you have that's going to help us do our jobs. So Leah, did you have something to say? You look like you were about ready.
Well, I think my understanding is that the audit for that year, you're not going to see this reflected in the audit because it doesn't go into that level of detail for the audit of the whole department. But we're in the middle of contracting with an external audit specifically for Measure O. So for the 21, 22, you'll see a very detailed audit. So that is my understanding. I'm not sure what differences you'll see between the first year of that 3 months and then the next year in an audit of the whole county. So what Gregory was looking at, but
Yeah.
I will definitely take back your concerns.
Yeah, let me project what I think you're going to find. You're right. There wasn't a lot of expenditures between April and June. This is the only one that I probably think you were probably spent, but you certainly got a lot more money in. So what I'd like to see is a fund balance that says, at least like we do on profit and loss balance sheets, 6 million in, 271,000 out, X amount left over, carried to June, 21, 22. And then, something that projects, this is what I would do, something that projects that money and the money you're going to get this year into a month by month, like Shirley's talking about. I mean, it doesn't mean, you can define our role as blessing a bunch of audits that are pretty superficial. I don't want to do that. I'd like to have a little more insight into how this money helps and what it's spent on. And that takes a little more detail. It takes a lot more, sounds like you're headed that direction by having an independent auditor look at it. But don't forget about this 3-month period that really started our process, and to which I thought we were going to get some real information today to start the business.
Yeah, and maybe
And that is the plan moving forward, is to have the report showing, fund balances. So you will get that. And then Gregory, can I ask what audit you're referring to when you said that you
Yeah.
saw,
the 6
information
million.
about the
December
behavioral
22nd.
health stabilization fund? And
Yeah, on December 22nd, the Board of Supervisors accepted the audit for 2021. It was by a group called Eiler or something or other. I can show you where it is on the board. On the agenda of the board, and that's where I got
And
it.
it showed Measure O getting 6 million?
No.
In that
It's-
fiscal year?
No,
Oh.
believe me, they did not go into, I dig deep and I can figure it out. In the narrative where it says, this is how much you had in, that increased the general fund. They have to report the fund balances. When they get to the point about what the hell made the general fund a whole lot more, healthier, they have lines that say it was because of this and because of this and because of this. One of those lines is Behavioral Health Stabilization Unit. It's like the second line. And they don't give the detail that says, well, this 48 million additional general fund was 22 million in behavioral health. I'd like to have that. But if they've only got 4 categories of giving you more money
That-
and one
yeah.
is behavioral, it's got to be more than $536,000. They would even mention it if it was that small. So I'm guessing if you went to the auditor and found out what was behind the general fund increase, which took us from, 200 and some million dollars in cash.
Okay, all right, let's let Susan comment on that. I think, Greg, your points are really well taken. There needs to be a lot more information if we're going to do our jobs as an oversight committee.
That's it.
And in terms of how these numbers get presented to us. And definitions and how the dollars get expended and how much we're taking in. Mental Health Services Act throughout the counties, throughout the state, got into some big trouble because they put all this money aside and they didn't expend it. And that's a sales tax too on luxury items. So we need to make sure that we are following how much money is coming in, how much money is going out, and the 5 categories. Just, again, we don't want to, we're not a bunch of CPAs, although I don't know, there might be somebody who's a CPA in this configuration. I'm not. But we all have read budgets before, and we've all done fiscal analysis and budgeting. So to get us as much information, Susan and Leah, just as you can. And what we can do is between now and our next meeting is that if we have questions or concerns, to please send them to the staff so that everybody's as prepared as they possibly can. Does that sound good?
Thank you.
Mhm.
Thank you. Yeah.
Okay.
Yeah, and then Gregory, if you could email Leah the
idea.
audit report that you're showing, so that would, that's the CAFR. So, okay, yeah,
Right.
okay. I thought maybe you were looking something that was specifically for Measure O. So this is the annual
In here,
county audit.
It's the county audit. When the auditor says you got a whole lot more money because of this thing, which is down here and page like 75 or something, you know, that's what I'm talking about. And it's not hard for the public to get a hold of the county's audit.
No, that's
But the
okay. It's just that the
stabilization
behavioral health
unit, yeah.
stabilization fund, it's not general fund money. It's not general fund. It's money specifically set aside, you know, for any kind of audit paybacks that we have.
Okay, I don't doubt, and I may have the wrong terminology, but I looked for anything mental health in the budget and found that. Okay, I also found mental health, you know, the one that Shirley knows all about from the past. But, you know, so I'm just saying, looking into the budget, looking into the audit for mental health, we should be able to easily identify Measure O, you know, in the past stuff and in the future, because we don't want to have people chasing around, not finding what we want them to know about.
Yeah, so I think there was a lot of issues over how the Ag and Open Space District, how much money we took in and what we were using for. So this whole issue has been before us before. So we do need to know exactly what those dollars are. They can't just go into a lump fund, because then we're not doing our due diligence. So, okay, I want to be mindful of the time. It's
The Measure O funds aren't,
Yeah. Go ahead,
they're not
Susan.
listed, but they're there. and
the Measure O funds aren't going into that behavioral health stabilization fund. So I just wanted to make that clear.
That's
Okay,
good.
where are-
Thank you.
We just need to know where they are. And
Yeah, we
how
just
the
want-
audit reports on it.
Yeah. All right.
Okay. Okay.
Okay.
And like I said, moving forward, we'll have that information for you.
Yeah.
We need to wrap this meeting up.
Yeah,
because
let's
we are
wrap
over
this up.
time.
Yeah.
All right.
So
You
what else
are-
do we have here, Leah, on our agenda for the day?
That's really it. So the
That's it.
next meeting, if this time works, the second Wednesday at 4:30, and we will stick to our time. Is that good for everyone? And if we're shooting for April, that would be April 6th at 4:30.
Mhm.
Great. Via
April-
Zoom for now.
Via Zoom.
Okay.
Sounds good.
We'll do it.
Meanwhile, let's give the staff, I'm very mindful that staff work really hard on a lot of different things. And sometimes it's hard to prepare all the information that we request for the meeting. So I want to give them as much time as possible. So I guess I would just request that if we have requests regarding, again, the expenditures and the programs, to get those requests to the staff within the next 2 weeks so that they have time. And yeah, the more information, probably the better. But we also want to keep it simple enough so that we can go back to the public and say, this is what we did with Measure O. That's why we're here, right?
Yep.
Okay, with that, so the next meeting will be on April 6th at 4:30. We are going to do another Zoom meeting. And then we can get some of the other meetings scheduled also maybe between now and then. And the doodle poll, I think, worked well, Leah. So thank you for sending that out.
Great.
Yeah. And then if there are suggestions, requests, whatever, you can fill them through me and through Leah and Susan. And actually, Susan, you're standing in for somebody tonight, aren't you?
She is, yeah.
So we don't want to inundate Susan.
Yeah, I think I don't know who is supposed to be here.
Okay, yeah, okay. All right, and then as you get closer to hiring that auditor and then the Measure O person, just fill us in as those things progress also, Leah. Okay,
Will do.
okay, great. All right, we have public comment.
We have no public.
We have no public, okay, no public comment, okay.
That's-
So we can all have dinner tonight.
Yeah.
But we do want the public to comment. This is really important. This is the public's fundings, and the public passed this measure. They wanted it. So hopefully we will have some more public attend next time and to, advertise it a little bit like somebody was suggesting.
Can I ask if this recording is going to be posted somewhere?
It is not. It is not going to be posted. We post minutes of meetings.
Why
Okay.
not? Takes like 15 minutes.
Well, that is not our practice to post recordings. If you all would like it posted, I'm happy to do that.
Well, the cities and the counties are beginning to learn how to do it. It posts to YouTube fairly easily. Zoom will dump an MP4 into your own computer and you can upload it to a YouTube channel. I've got.
Okay, well, we can talk about that as we
Think
move
about that.
forward. I think we don't, like I said, we don't want to inundate the staff at this point.
No, I know. And because it's so simple now, a lot of people.
It's not hard. Absolutely. We can
Okay.
do that.
Awesome, awesome. I just, again, want us to find a way to get the message out that we are meeting and members of the public can attend. So we'll work on that between now and April.
Thank you.
So I want to thank everybody for being here. I want to thank all of your passion. It's going to be a little bit of a bumpy ride because this is a new committee and it's a new tax measure, but that's what makes it so exciting too. So I may send out a few things to you guys between now and April, just some thoughts to consider for the next meeting. And if any of you have ideas, let me know, let Betsy know, let the staff know, let's share them.
And what impacts
Thank
mental health
you.
is pretty broad now. So I will try to help you understand what's happening with ARPA that I
Okay.
think has an impact on mental health among underserved in particular.
Okay, great, great. Okay, thanks, everybody. I'm going to call the meeting adjourned. I don't have a gavel, I have a pen. Boom. All right.
Thank
thanks,
you.
guys.
Bye now,
Chair Green.
everybody.
Thank you
Okay,
so much.
Bye, everyone.
Bye-bye.
Bye.